Hi, I'm Dr. Alison Vandekerkhove. I'm one of the medical directors at SIBO Canada, and today I'm showing some of the common errors that are done when doing a breath test. So first, one of the main common errors is people having either antimicrobials, antibiotics, or basically anything that's going to kill off bacteria or put in bacteria like probiotics too close to doing your test. So for antimicrobials, we recommend being off of it for 2 weeks, and for probiotics, we recommend being off of it for 1 week. The other thing is laxatives. So probably the most phone calls we get through SIBO Canada are, is it okay to take a laxative? And I know that the thought of not taking a laxative for 4 or 5 days before doing a test is painstakingly horrible for some people. My recommendation is if you use a particular product chronically, so you use it all the time, you can continue using it up to your prep diet. If it's something that you're using that's brand new, I recommend avoiding it for the 4 days. PPIs, so medications that decrease acid in the stomach, are also recommended to be off for at least a week to 4 days before the test. I also recommend to people that if they can't handle this, they can also do it up to the prep diet, and then just make sure you write it on your requisition so that we know that that medication was given right up to the prep diet. This is your requisition form. Make sure that when you ship the kit back to us, this requisition form is included in it. The most important information we need is your name, your date of birth, the referring doctor's name, and the clinic email. We should be able to find everything after that. If you changed anything or forgot anything, if you put the note right on the requisition form, the lab tech will know to look for it so that we can calibrate it correctly. Some common errors that are done when doing the breath sample is one, breathing too hard into the bag. When you're doing a breath sample, you want to make sure that you have just a normal expiration of air, like this. You want to make sure you're not blowing too hard, or else we're going to get way too much carbon dioxide in the sample, and the sample will be no good. The other error we get a lot of is when patients pierce the tube, they remove it before they have stopped blowing. Make sure that you remove the tube and you're still blowing in the bag, like this. When you're all finished, make sure that the tubes are labeled correctly. So the first one is your baseline, which is done before you take your lactulose drink. And then test tube 1, which you labeled, is done 20 minutes after your lactulose drink. After the tubes are, make sure you do put them in the bubble wrap. Shipping can be a little bit hard on these samples, and we want to make sure that the samples are taken to our clinic correctly, to the lab. And then make sure that you use the shipping that is already on the box. Don't use your own shipping so that we can get it to the lab in the right amount of time. If you have any questions, you can always phone your doctor or your lab and we can give you better instructions. Thank you.